Chapter 8 is on joints. Be sure to pay attention to the outline as we are skipping some joints and some sections entirely. Joints are classified according to the structure and movement. By structure, that means what material is binding that joint together, what is binding the bones together. And movement is whether there is no movement, a little bit of movement, or a lot of movement. Joints are called articulations. To articulate is to meet. And so an articulation is where two bones meet. This is the only point at which movement of bones can occur. Joints allow mobility, and the amount of movement is determined by the structure of that joint. We categorize joints functionally and structurally. Functionally by range of motion, and structurally by anatomy. The functional classifications are pretty easy. SAD, synarthrosis, amphiarthrosis, and diarthrosis. Syn means together, and in a synarthrotic joint, there is no movement. These are very, very strong joints. An amphiarthrotic joint allows for a little movement, and a diarthrotic joint is freely movable. And this is the joint that we think of like our elbows and our knees. Be comfortable with this chart. Know your functional categories as well as your structural categories with an example of each. We'll go over each type. The structural classification begins with fibrous joints. A suture is a fibrous joint. Sutures are located in the cranium and hold bones together. A gomphosis is what holds our teeth into their sockets. A syndesmosis is not synarthrotic as the other two, but amphiarthrotic, allowing a little bit of motion. And an example of this is between the tibia and the fibula. Cartilaginous joints are held together by cartilage. A synchondrosis is fairly rigid, and it is a joint between the ribs and the manubrium of the sternum. A symphysis is also fairly rigid. It is made up of fibrocartilage, and we find these. A good example is between the hip bones, the anterior surface of the hip bones where they meet. A bony joint is a synostosis. It is synarthrotic, that is, there is no movement. An example of this is the frontal suture, as well as we'll see in a little bit in the bones where the epiphysis joins the diaphysis and as bony material. The synovial joint is what we're most comfortable with. The elbow or the knee. This is diarthrotic with the greatest range of motion, and these joints are located at the end of long bones. Which of the following is not associated with a gomphosis? Fibrous cartilage. What is the structural joint category for sutures? Fibrous. Which of the following is an amphiarthrotic joint? Syndesmosis. These joint categories would be great on flashcards. So this is a typical synovial joint. Synovial joints have a lot of common characteristics. At the end of each bone will be articular cartilage, and this is hyaline cartilage. And it is for lubrication and reduction of friction. Here you can see an example of a synostosis, where the epiphyseal disc has ossified joining the epiphysis and the diaphysis. Look here at some of the other features of this synovial joint. The periosteum of the bone is continuous with the capsule of the joint. The joint is lined with synovial membrane, which produces synovial fluid. ligaments are bonding the bones together in this joint. And there is a joint capsule or articular capsule, as well as a joint cavity. The joint capsule or articular capsule is a sac that encloses the articular ends of the bones in the joint. It's reinforced with certain structures such as tendons and ligaments, and we'll see that specifically in the knee. You do have to know your knee joint. And that joint capsule is continuous with the periosteum for strength. The synovial membrane lines the capsule. This synovial fluid lubricates, cushions, prevents abrasion, and supports the chondrocytes, and makes very little fluid, less than 3 mils. This synovial fluid is clear and viscous. It has a high concentration of hyaluronic acid, and it's produced by the synovial membrane. It lubricates, it allows nutrient distribution, as well as acting as a shock absorber. So there are accessory structures to the knee. In Moodle, there is a knee diagram. You need to print that out and be able to label that. For some of the accessory structures are tendons and ligaments. For example, the quadriceps tendon is holding the quadriceps muscle to the patella, and the patellar ligament is holding the patella to the tibia. We'll see a variety of ligaments inside the knee between these, the fibia and the femur and the tibia are the two, the ACL and PCL, anterior cruciate ligament and posterior cruciate ligament, and there is a lateral and a medial ligament. We also find fat pads, bursa, meniscus. And these bursa, here, I've added a picture of a bursa in a shoulder. A lot of people have painful shoulders. It's because of this swollen bursa here. A bursa is a small fluid-filled sac, and it's filled with synovial fluid. And it reduces friction, acts as a shock absorber. Here's a bursa anterior to the patella. So if you land and fall right on your knee, it would be the bursa that would be a shock absorber so the patella doesn't crack. Fat pads are also found in these synovial joints. It's usually superficial to the joint capsule. It protects the cartilage and it fills spaces. A meniscus is a pad of fibrocartilage, a very dense type of cartilage, and it's between opposing bones in a synovial joint. This picture isn't the best to show the meniscus, but often if there's damage to the knee, there's damage to that meniscus. Accessory ligaments support, strengthen, and reinforce. There are capsular ligaments or intrinsic ligaments, and accessory ligaments. So pay attention to the picture in Moodle. That's the picture you need to know for the structures of the knee. So with a synovial joint, which is diarthrotic, there's the greatest range of motion. Therefore, it will be one of the weaker joints. Synarthrosis are strong joints because there's no movement, and diarthrosis are the most mobile joints and the weakest. Movement beyond the normal range of motion is called a dislocation or luxation. And in this case, the articulating surfaces are forced out of position. These joints can be put back into position, but there's quite a bit of pain. What is a bursa composed of? Synovial membrane. What covers the surface of a bone at the articulating surfaces within a synovial joint? Articular cartilage. What is the source of nourishment for articular cartilage? Synovial fluid. Which of these is a pad of fibrous cartilage within some synovial joints? Meniscus.